someone make a motion on the executive order pursuant to the Governor's Lee's Executive Order number 16 regarding electronic meetings as extended by Executive Order number 34. Would you make a motion that this committee meeting agenda constitutes essential business of the Metropolitan Council and that meeting electronically is necessary to protect the health, safety, and welfare of Tennesseans in light of the COVID-19 outbreak?
So moved.
So
Second.
Is there a second? Thank you very, very much. So I guess to have a roll call, I will be able to indicate that I have Council Lady Benedict. Are you with us?
I believe she's in planning.
Okay, Councilman Glover. Councilman Hall.
I believe he's also in planning.
Okay, so we have Porterfield, Pulley, and Welch who's with us in her. So that will give us a quorum. So I do detect a quorum today, and thank you all for coming. We have 2 items on the agenda. But before I go to the items, first, let me thank you all for the emergency meeting that we held on yesterday. I wasn't able to be there for every meeting, but the parts that I heard, it sounded like it was a very spirited and productive discussion. So I really thank you all for that. And thank you, Council, for hosting the meeting. We have 2 bills. Bills number 22, Mendez, Hurt, and others. This is a bill that amends on second reading, amends the Metro Code by abolishing the Nashville Career Advancement Center and moving the functions of that agency to the Metro Action Commission effective July 1, 2020. This is, I have a letter from Councilman Mendez approving. Can I get a motion?
So moved.
Second.
Thank you very much. This is a move that I know is in terms of to reduce the cost that the city has spent for the Nashville Career Advancement Center. I know that Metro Action Commission is very capable of handling this. They've done quite a few things from children to adults through their GED program. They've already have a workforce development program. They've done skills training and just a number and a plethora of things that they do to serve the community as it relates to job readiness and job skills. So I know that Councilman Pulley served on that board for quite some time, and Councilwoman Swora has been on there as well. And I now serve as the representative from Health and Hospitals. So Councilman Pulley, is it anything you'd like to add to this bill that you'd like to say, knowing your familiarity with Metro Action? Well, I guess Councilman Pulley is gone. He was on here.
You're muted, Russ.
My mute finally works.
Okay.
All right, am I unmuted now?
Yes, you are.
Okay, thank you. So I spent 2 years on the board. I think you said it very well. And I have a great deal of respect for Metro Action Commission. And when I saw that they would be taking all this over, I'm perfectly fine with that. And I'm very supportive of Dr. Kroom and her staff. I'm sure she'll do a fine job designating the right person to deal with this.
Exactly. Any other comments or discussion? Council Lady Swore, are you on the call? Okay. Well, all in favor?
Aye.
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 Any opposed? There being none, the motion passes unanimously. There is also, now I know that they were talking about they were not accepting late resolutions. But I do have on the agenda a late resolution that's filed. Councilman Rosenberg, are you still with us?
I am.
Do you know if this is something that we need to still bring forth? Are they going to accept it? But it was my understanding that no late resolutions were being filed.
I'm sorry, which one were I was talking to my son?
This
Which
is the one with Sledge, O'Connell, and others in regards to to stop the practice of sharing COVID-19.
I hadn't heard anything about that not being offered, and that was included in the Rules Committee agenda that was just sent a few minutes ago. So right. I think it's moving forward.
Councilwoman, if I may, I believe Vice Mayor Schulman said that after this resolution was already filed, so it was my interpretation that there was not going to be any additional late file resolutions, but that which was already filed would be heard. That was my interpretation.
Okay, all right, great. Thank you so much. So we will go ahead and act on this resolution. It is regarding a resolution requesting the Metro Department of Public Health for the following lead of the Tennessee Department of Health and stop the practice of sharing COVID-19 patient information with law enforcement. Unfortunately, I do not have. I'm
a sponsor on it, Councilwoman. They added my name late, but I'm a sponsor on it.
Okay. So do you want to suspend the rules and ask that we hear it?
Yes, please. I would like to suspend the rules.
Is there a motion? Is there a second?
So moved.
Thank you. It's been properly moved and seconded for suspension of the rules to offer this resolution. Now that we have all in favor for the suspension of the rules?
Aye.
Aye.
Any opposed? There being none, we can now then have a motion on the resolution itself.
I would like to move the resolution, please.
Second.
Please. Thank you. It's been properly moved and seconded. Any discussion or questions in regards to the resolution itself? I think Council Lady Benedict has joined us. We're on the late resolutions filed by Councilmember Sledge, O'Connell, and others in asking that we follow the lead of the Tennessee Department of Health to stop the practice of sharing COVID-19 patient information and with law enforcement. Is it anything that you'd like to discuss as it relates to this resolution?
Thank you, Chair, for recognizing me. I absolutely think that this is critical that we take care of this in particular because we have plenty of PPE, so there is no reason for us to send first responders out to any location and with the need to disclose to our first responders that someone at that location has issues of concern, but rather when we do send someone out and there is any concern that may be the case, they should have full access to PPE. So there's no reason why we should be collecting and distributing this information. In addition to Nashville, the state of Tennessee is what I mean to say.
Right.
No longer captures this information, and I think that at a minimum, Nashville should follow the state of Tennessee, as well as many other municipalities who are no longer collecting this information and sharing it, or who never have. This is, frankly, been met with hostility by our Department of Health, and we need to let them know that, and the administration know that we should not be collecting this information, and that the council does believe that we are able to protect our minority population and those who may have fear of immigration concerns or healthcare concerns. We need to make sure that they are not put in a position of unease. And so that if they have concerns that they may have COVID, that they are able to get that test. So I am absolutely in support of this. Thank you for calling on me, Chair.
Thank you very much. I know Dr. Caldwell was Minority Caucus call last night, and he did have some comments in regards to that. Council Lady Porterfield was very instrumental in driving that conversation. Would you like to add something else to that, Council Lady Porterfield?
Thank you so much, Chair. I'll be brief. I know we're about at our time here. When we first realized that this was happening, we were not informed by our local law enforcement or our Department of Health. We found out this information through the media, and there's been a lot of conversation around looking for policies and looking for ways that we can both keep our first responders safe as well as address the privacy concerns of the community. So what we're seeing is there have been several members, not only in the immigrant community or in the minority community, but just in general, people in Nashville are saying that they don't want their information shared, their private health information shared with the government and with government officials. The pushback on that was that we really want to keep our first responders safe. So we want to make sure that we're keeping, our firefighters, police officers, and our other first responders. We want to keep them safe, but we want people's information to be private. So we are urging that the department comes up with a policy that will do just that will keep people's information private, but that will also keep our Metro employees safe. Unfortunately, up to this point, we don't have a good policy from those departments. This has been an ongoing conversation, and we just ask that you support this legislation so that we can keep people's information safe. Lastly, I'll say that this has been an issue that has crossed many demographics. This has crossed party lines. This has crossed different groups and ethnicities. A lot of people are having these concerns about their private information being shared. So when you hear so many people on different sides of the issue sharing the same concern, we know that this is something that we need to move forward with. So we just ask for your support. Thank you.
Thank you very much, Council Lady Porterfield. And I personally am concerned about the violation of HIPAA laws and our liability in terms of sharing personal information or personal health information such as this. So is there any more discussion by the committee members?
Yes, I would like, is there anybody from the law enforcement community here to discuss this resolution today? You see anybody on there?
I do not.
Get their opinion. I don't happen to share the same view that law enforcement does not need this information. I do understand and empathize with the position of communities who are concerned about their information leaking out. I don't think that law enforcement has an interest of doing anything with this information other than keeping themselves safe. I hear the calls for a policy without having law enforcement weighing in on this. I'm a little concerned about advancing it further. So I'm going to be a no vote on this resolution because of that.
Okay, thank you, Councilman Pulley, and understandably so. It has been properly moved and seconded, and we've had discussion. Any more discussion to be held? There being no more discussion, all in favor say aye.
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 Would you please indicate your name and your vote so we can do a roll call? I'll be able to say so.
Jenny Welsh, aye.
Porterfield, aye.
Benedict, aye.
Pulley, nay.
Benedict?
Aye.
And Hurt, aye. So we have Welch, Porterfield, Pulley, Hurt, Benedict. 4 in favor and 1 against. So the resolution passes. Thank you. That is the end of our agenda. I entertain a motion of adjournment.
So moved.
Second.
You all later. Bye-bye.